professor at Ankara University School of Medicine. He joins us now from the Turkish capital. Doctor, thanks so much for joining us here at TRT World. You know, all of us here in Turkey were waiting to hear this news. However, some will have to wait to reopen longer than the others. Why is that?
Well, this new strategy is really important for Turkey. It can be a game changer for Turkey because based on these risk groups, cities will be divided 4 groups on the basis of the cases, number of the cases. For example, cities with less than 10 cases in 100,000 will be called as a low risk, 10 to 50 intermediate, 50 to 100 high risk, and more than 100 cases in 100,000 will be called very high risk city. So this is a good strategy because from now on, rules and regulations, precautions regarding the lockdowns will be decided not only by health ministry, but also by local authorities such as governor, mayor, city council, and health authorities. So with this new regulation, each city will compete with each other in order to catch the lower number of cases and also to reach the higher number of vaccine doses. So based on this, for example, cafes, restaurants, and mail-only cafes will be opened in the low-risk cities, and also face-to-face education can be started in these low-risk cities. This is important strategy, and
right.
I think Turkey will have some kind of advantage with this new approach.
Right. Erdogan also mentioned that the authorities will discuss the reopening of cafes and restaurants next week. But can we expect pandemic to change the way they operate in the future?
Well, for sure. With this new regulation, I think each city will be careful and they will follow their cases, and also they will follow their vaccine, number of the vaccine and the vaccination rollout. Because as you know, vaccine rollout has some slow pace in Turkey compared to United States, England, United Arab Emirates. So we are a little behind. So we have to have with this new strategy, we can increase the number of the vaccinations. For example, we have to vaccinate at least 300,000 cases, 300,000 people in a day, and maybe 2 million people in a week. And then we have to be able to reach 8 million people in a month in order to have good vaccination pace. For example, with this slow pace, Turkey will be able to finish its vaccination schedule in the middle of 2022. But if Turkey vaccinates 8 million people in a month, Turkey can be able to finish its vaccination schedule at the end of 2021, and we can catch up the United States, England, United Arab Emirates, and Israel.
Okay, doctor, thanks so much for explaining all that to us here on TRT World. Dr. Taner Demirer, a professor at Ankara University School of Medicine.